Hello, students. This is part two of chapter 8. We last left off at the supplemental health insurance. So, going over this slide, some patients have supplemental secondary insurance in addition to their primary coverage insurance to address uncovered services. So, keep in mind, as I repeated in prior slides, it's possible that you can have two different insurance companies or insurance plans at the same time. And usually one is your primary, which is the main one that you bill. And then the secondary will pick up anything that the primary insurance does not cover. But one key thing I want you to remember, since when people have dual coverage, sometimes this is called coordination of benefits, which is having more than one insurance. Whenever you have Medicare and Medicaid, it's very important that you always bill Medicaid second. Medicare is never billed first. So anytime you have Medicare and Medicaid, or if you have Medicaid with a private insurance, you always bill the private insurance first. Medicaid is always the second payer. And this is just going back over workers' comp or workers' compensation. We usually abbreviate it as workers' comp. And again, basically, this is where if you got injured or if you got sick at your job, based on neglect from the company, your company or your employer will pay your medical or prescription expenses. And it gets billed under workers' compensation. And normally it's a pretty easy process. Basically, the only ID they really need is your social security number, is usually your ID number. So this is the insurance that covers any work-related injury or medication that is needed based on that particular injury. Workers' compensation continue. Employees do not receive a workers' compensation insurance card. There's typically just an 800 number to call. So nobody walks around with a workers' compensation insurance card because you never know when it happens. Again, it's just basically your insurer or your employer paying the medical or the prescription related costs. Now, here's where we go to the government insurance health programs. So basically, there are two major ones. There's Medicaid and Medicare, and we'll go over each one. Presently, most patients age 65 and over have some form of Medicare, while many low-income patients and families of any age have state-funded Medicaid coverage. So right off the bat, one of the difference between Medicaid and Medicare is that Medicare is typically based on age in most situations. But remember, I said if you have some kind of disability, regardless of your age, you could be eligible for Medicare. But traditionally, we think of Medicare when we turn 65. It's basically age related. Medicaid and Medicare is federally funded, whereas Medicaid is state funded and is usually based on income. Up until 1965, over 50% of citizens over the age of 65 years of age had no health coverage. This obviously have changed since 1965. Medicare and Medicaid were approved through the Social Security amendments of 1965. Note, there were no prescription covered for seniors until the Medicare Modernization Act of 2006. So this is actually fairly new. Normally what happened was when seniors turned 65, if they didn't have, prior to 2006, if they didn't have any medical coverage, they just applied for Medicaid. So basically, no, Medicare is administered by the federal government. Medicaid is administered by the state government. And remember, I told you Medicaid is state specific. You cannot use Texas Medicaid in Oklahoma or Florida. You just have to use it in your particular state. Medicare, since it's federally funded, if you happen to take a trip out of state, your Medicare is good in all 50 states since it's federally funded. Starting with Medicare, so in 2015, over 54 million persons were enrolled in one or more Medicare programs. Once a person reaches 65 years of age, he or she is eligible for the Medicare program. Other Medicare participants include those with a chronic kidney disease or those who have received Social Security disability income for 24 months. Because of the debilitating nature of these diseases, patients with ALS, also known as Lou Gehrig's disease, are able to receive coverage from the first month of their Social Security disability coverage. So remember, Medicare, you can also receive coverage if you have some kind of debilitating disability. Medicare funding is drawn from a monthly premium automatically deducted from the patient's monthly Social Security check during retirement. So once a person is 65, they usually have a Social Security check, and the Medicare premiums are taken out of that or taken out of that check. Medicare does have a budget, unlike Medicaid, which is unlimited. You could actually run out of funds with Medicare year to year. It just depends on how many medications you're on, and if most of them are brand Medicaid or brand medications. And if they are very expensive brand medications, you can actually run out of your Medicare budget. One Social Security account has the accumulated amount from payroll deductions during one's working years. So this is typically what the Medicare card looks like. In pharmacy, we often called it the red, white, and blue card. They actually made some adjustments to the card because basically it used to be based on your Social Security number. I want you guys to be familiar with the 4 parts of Medicare, and they list it as Part A, Part B, Part C, and Part D. So each division of Medicare, each of the 4 parts covers specific items. So Part A covers hospital insurance. Automatically, when you turn 65, you have Part A. So this is health insurance that you can use at a hospital. So if you get treatment at Parkland, at Presbyterian, Baylor, you would be covered under Part A automatically once you turn 65. So Part A deals with hospital insurance or inpatient care. Part B is medical insurance. This is the insurance you would use at your doctor's office. So again, Part A is strictly to hospitals. Part B is medical insurance. It covers your doctor's visits if you got a primary care physician. Also covers outpatient services. DME is durable medical equipment. So it will cover like wheelchairs, walking canes, nebulizers, any kind of medical apparatus will be covered under Part B. Some Part B's plans cover diabetes test strips. So a lot of different supplies, medical supplies are covered under Part B. And some select prescription medications are also covered under Part B. It gets kind of tricky because some plans cover prescription medications, or some of them, usually the expensive ones like the cancer medications, may be covered under Part B rather than Part D. Part C is also known as Medicare Advantage. This is more of an administrative part of Medicare. You won't see this at the pharmacies. Sort of think of it as basically, as I just said, the administrative part. It basically connects the administrative part of Medicare, like your HMOs and PPOs. That's covered in Part C. Part D is prescription drug coverage. The way to remember that is D for drugs. This part covers the majority of the prescription medications, but keep in mind, in some cases, Part B covers prescription drugs as well. Vaccines could be covered under Part D or Part B, and some medical supplies. Now, there's really no way you can actually mess this up because there's no set rule of what medications are covered under Part B or Part D. They just specific to the person's plan. If you bill Part D and it's covered under Part B, you will get a rejection telling you to bill it under Part B, and vice versa. If you try to bill something under Part B and it's supposed to be covered under Part D, you will get a reject message saying not covered under Part B, bill Part D. So you really can't mess this up, because if you get them confused, rejection will populate and it will tell you which one to bill under. So generally, the Medicare branches A, B, C, and D are independent, and there's no dual cross coverage. Generally, what is not covered or covered in one subgroup will or will not be covered in the same group. So basically, this means, for example, if textures are covered by Part B, then it will not be covered by Part D. So it's pretty simple. So there's no two different parts that covers the same thing. It's either covered in one or the other. So this is just a review of Medicare Part A. Typically covers 80% of the cost of hospital stays. And then you can read through the rest. Any person who reaches age 65 and submits an application automatically qualifies for this health coverage. So just read over these slides. So Medicare Part A, this basically just breaks down what they actually cover. Medicare Part B, this is basically more of the important one, because this is the one that covers your primary doctor. But they don't usually cover prescriptions. Special prescriptions they'll cover. But normally, if you want a set amount of prescriptions, you need to have Medicare Part B. So Part A is pretty much automatic. Part B and Part D, you pretty much have to physically enroll in those plans. And again, Part C is an administrative, like behind the scene. You don't have to enroll in that. It's just automatically done. But Part B and Part D, the person has to actually physically enroll in those plans. And there's numerous of plans that they can enroll in. And here's just a slide to tell you what's covered in Part B. So they cover various different types of screening, some medical supplies. So this just gives you some flu shots will be covered in Part B. I'm pretty sure when the COVID vaccine becomes available, it'll probably be covered under Part B. So this just gives you an idea of what's covered under Part B versus Part D. And this is just some more information. Part B covers durable medical equipment, so wheelchairs, walking canes, strollers, those all will be covered under Part B. That is what is meant by durable medical equipment. Part D, again, that stands for prescription drug coverage. It went into effect under the Medicare Prescription Drug Improvement Modernization Act of 2003. This is what covers basically your prescription drug plans, and there's numerous of prescription drug plans. Enrollment usually starts as early as October of each year, and it usually runs through the last day of December. If the person already has a Medicare plan, they can change it anywhere between October and December if they want to move to a different plan. If they do not change their plan, it just rolls over. When the next year, which is 2021, starts, they'll have the same plan that they have in 2020. But if they didn't like the plan they had in 2020, between enrollment dates, again, which is between October and December of each year, they have the option to move to another Medicare plan. Again, if they forget or they just keep their plan, it just rolls over. So again, you can just read through this slide. But just the take-home message is Part D basically covers prescription drugs. Here's some more info for Part D. Almost 40 million patients who are eligible for Medicare have taken advantage of signing up for the Medicare D insurance plan. So remember, Part A you automatically get when you turn 65, but you don't get Part D when you turn 65 or Part B. You have to physically enroll in those plans. And here's what I was talking about, enrollment period. Basically starts in October, ends December 7th, give or take. The coverage starts back up in January 1st. If you choose not to select a new plan, when January 1st arrives, you just have the same plan that you had the prior year. Again, this is more information about Medicare D. Remember, Medicare D, you have a budget. Okay. You can actually run out of your budgets. It just depends on how many medications you're prescribed and whether most of them are brand. Brand medications will eat through your budget very quick, especially if they're available generics. If you actually reach your limit and you run out of money, you go into what is called a coverage gap or a donut hole. Once this hits, your copays will go up considerably because Medicare is not covering a big percentage of what they were normally covering um, when you were below the donut hole or when you were not in the donut hole. So basically, the take-home message is Part D. You have a budget, and the budget is anywhere between roughly about $4,000 is the budget. But again, some people eat through that $4,000 before the year is over and they go into the donut hole. But there's still an option that you can take if you reach the donut hole. You can sign up for catastrophic gap coverage. So once you go into the donut hole, the catastrophic prescription drug cover kicks in and the patient pays only 5% of the medication costs. And this is just an example of a donut hole for like 2019, if you can read through this. It'll be pretty wise for a person when they sign up for Medicare, if they know they're going to be on a lot of brand drugs that don't have any available generics. When you sign up for Medicare, it would be very wise to select the catastrophic gap because more than likely, if you're on a lot of medications and many of them are brand medications, you're going to run through your budget. And usually you run through your budget. I've seen it as early as September, but usually around October, November is when a person usually hits the donut hole. And again, if they signed up for the catastrophic gap insurance, it kicks in automatically once the person hits the donut hole. And they just left with only paying 5% of their prescription costs. And again, once the catastrophic coverage period starts, you will pay $340 for generic drugs and $850 for brand drugs. Normally, before you have catastrophic gap coverage, you're normally paying about $1.10 for generics, and I think about $3 for the brand. But if you didn't have catastrophic coverage, it can go up considerably. Like it could be $30, $40 for the generics and a certain amount for the brand. That's if you didn't have the catastrophic coverage. And again, this just breaks down the steps that you can overlook of how the Medicare and the donut hole actually works. I do want you to know that Medicare, there's certain medications that they don't cover. Medicare is pretty specific because there are a lot of medications that they don't cover in certain drug classes. Medicare will not cover over-the-counter medication. Typically, most Medicare plans, there are some exceptions, will not cover. BZD is benzodiazepines. Those are drugs like Prazolam, which is Xanax, Ativan, Valium. They usually don't cover medications like this, but there are some plans that are starting to cover them, but most do not cover these meds. Medicare does not cover agents used for symptomatic relief of cough and cold. So and I know that doesn't sound right or whatever, because you would think that people over 65, they have to go through the flu season as well, and there's chances that they could get sick. But Medicare does not cover prescription cough and cold medication. Medicare will not cover anorexia is people who lose a lot of weight. There are medications to treat that illness. Medicare will not cover anorexia medications, any kind of weight loss medications or weight gain medications. They consider those cosmetic. They will not cover those types of medications. They will not cover anything for cosmetic purposes. There's a medication called Latisse. spelled Latisse. It's basically a medication that actually grows your eyelashes thicker, but Medicare considers that a cosmetic medication or a cosmetic purpose, so they won't cover that. Another medication is Propecia or minoxidil. That is a medication that treats male pattern baldness. So there are some men who don't want to lose their hair and they get prescribed that medication, or their hair starts thinning and they want to try to regrow it back. So they get prescriptions for those medications. Those are still cosmetic purposes. They're not medical necessity. If you lose your hair, um, nothing bad is going to happen to you physically. You just be a man with less hair than what you normally had. So Medicare will not cover any type of cosmetic medications. Medicare will not cover any kind of erectile meds like medications for erectile dysfunction like Viagra, Cialis, Levitra. They obviously will not cover those type of meds. Medicare will also not cover medications that are classified as DESI drugs. DESI drug stands for Drug Efficacy Study Implementation. Basically, what these drugs are, they are drugs that are still on the market, but the FDA has determined that they're not very effective. A lot of the cough medications, even the prescription medications, fall into that category. They basically just, the FDA has deemed that even though these are prescription medications, they're not entirely that effective. They just relieve some of the symptoms, but they don't work that well. And if they fall into that class, Medicare will not cover them. And again, Medicare Part C, basically known as Medicare Advantage, just kind of look over this. This is more of a backroom administrative plan. No one will ever give you a Medicare Part C card. As a technician, you will never bill Medicare Part C. It's all administrative. And just look at these slides, because that's all Medicare C is. It's just people doing backroom work on the Medicare plans, office, administrative things. That's all that is. Okay, so up next is Medicaid. So Medicaid is typically state funded. You can have Medicare and Medicaid, and as I mentioned a few times, if you have them both, Medicaid is always the last one to pay, always. Medicaid does not cover prescriptions that are filled in a state other than the state in which the patient resides. That's what I was stating, that if you're in Texas, you can only use your Medicaid in Texas. If you live in Oklahoma, you can only use your Medicaid in Oklahoma. To help citizens get insured, the Affordable Care Act provides financial incentives for states to extend their Medicaid eligibilities to cover more uninsured patients. So that was one of the provisions of the Affordable Care Act, is to work with the state to make it easier for a patient to be eligible for Medicaid. So basically, the Affordable Care Act just basically tried to get as many people insured as possible. If they couldn't get private insurance, they had provisions where the person will be eligible for Medicaid. And this is Medicaid Continue. Adults enrolled in traditional fee-for-service Medicaid are limited to 3 prescriptions per month. There is a Medicaid where the person is only allowed, and it's called fee-for-service, is only allowed 3 prescriptions per month. It's a rare type of Medicaid, but there's different types of it. All other Medicaid eligible individuals are allowed an unlimited amount of prescriptions. So this one, the fee-for-service Medicaid, is people who are a little bit above the minimum income requirement, but they meet the requirements for the fee-for-service. So basically, the Medicaid just covers up to 3 prescriptions per month. So Texas Medicaid program. So you have quite a few. You have the traditional Medicaid. This is the Medicaid that has unlimited coverage. This is by far the most popular one. But you do have some other types of Medicaid. You have the CHIP, which stands for Children's Health Insurance Program. And basically, this one basically covers children from the ages of 0 to 19 whose parents earn over the federal poverty line, but too little to cover healthcare insurance for their children. So this is like for parents, they have kids, they make a little bit too much to meet the regular Medicaid income requirements, but they don't make enough to have traditional private insurance. So the children can be protected under CHIPS. CHIPS will have copays. So Medicaid typically has zero copays, but CHIPS, don't hold me to this because I haven't been in retail since 2015. But back in 2015, if you had CHIPS, I believe generics were $5 and brand medications were 20, I believe, give or take. It's probably has changed since then, but just know that CHIPS will have copays. Children with special healthcare needs. This helps children 20 and younger who have special healthcare needs and people with cystic fibrosis. You got the Healthy Texas Women Program, HTW. This is a program dedicated to offering women's health and family planning at no cost to eligible women in Texas. So typically, this is common when women are pregnant. Usually their visits will be, if they're going to their gynecologist, or if they get prescription for birth control or prenatal vitamins, all of that will actually be covered. The Kidney Health Care Program. This is a statewide program that helps Texas with end-stage renal disease, pay for their treatment. So end-stage renal disease is usually for people who are on dialysis. They have severe kidney damage. So if they're eligible for this program, it's still funded under Medicaid. It helps pay for their medication and treatment. Then you have the Healthy Texas Women's Plan, which covers, you can just read through these, all types of screening and pelvic examinations. So cost avoidance for Medicaid. This is also known as coordination of benefits. This again repeats that Medicaid should be the last payer in the majority of the situations. There's a universal code that rejects in the pharmacy when you're billing insurance company. If you're billing someone who has Medicare and Medicaid, and you accidentally bill Medicaid first and Medicare second, you will always get this reject. It's reject 41. It'll tell you submit bill to other processor or primary payer. So that reject is basically telling you that you have your sequence out of order. So if you bill Medicaid first and Medicare last, you will get this reject. And that's basically telling you to reverse the order and bill Medicare first and Medicaid second. So this is a universal reject code 41. And just know that there's different types of Medicare carriers, and some of them have been outsourced to private insurance groups. So remember, Medicare was basically ran by the state at one time, but that changed in 2013. It got outsourced. So you have numerous of different Medicaid plans, and they are contracted through roughly about 17 different PBMs. So you got Aetna Better Health. Aetna is a private insurance, but it also runs various Medicaid plans. Amerigroup is very popular. You got Parkland, Cook Children's. Molina is another popular one in Texas. Probably the three most popular ones are Amerigroup, Parkland, and Molina. So this is just letting you know that the Medicare carriers have been outsourced, some of them to private insurance companies. So they're doing actually all the work, the billing and everything. So it's been outsourced. Affordable care insurance exchanges. Again, this has been in the news as I am speaking right now. Um, Many people are not covered by either government-sponsored or employee insurance. You have small employers who have fewer than 50 employees. So remember, the Affordable Care Act only made it a mandate if the company or business employed more than 50 full-time people. But if you got a small business and you have only 5 people or 10 employees, there's no mandate for the business to offer insurance to everyone. So many small employers have elected not to provide health insurance coverage as an employee benefit because it's too expensive. So remember, part of owning a business is when you have employees, you want to offer them insurance, but if you're a business owner, you have to pay a certain amount to have your employees insured. That costs your company money to insure you. Um, so if you're a small company, more than likely you don't have the resources to offer insurance to your employees. Um, so in those cases, the employee or the employees rather, um, the workers have to actually purchase their own health insurance on their own. And that's still possible. That's known as exchanges, where you can actually go online and actually purchase your own health insurance if your company doesn't offer one. And you can actually, I wouldn't think this would be a good idea because if you work for a big company, normally they'll have a very good insurance that they can offer their employees that you can enroll in. But you can select not to take the company's insurance and still try to go through an exchange. But the exchange usually are a little bit more expensive than what your company can offer you, specifically if you work for a big company. So self-employed contractors and entrepreneurs also have to find insurance on their own. So keep in mind, you have people who they don't work for a company; they work for themselves. People who are contractors. They own their own business. They work by themselves. Um, they still can get their own insurance. In addition, employees working part-time, less than 30 hours per week, or who are underemployed also need to find insurance as well. So usually I think the law is if you work less than 30 hours, you're considered part-time. And if you consider part-time, an employer does not have to offer you insurance or cover you under insurance. That's what I believe the law is, but don't hold me to that. Um, Actually, I think that's what it is because I remember Walmart um, getting in trouble for having that practice. Um, Walmart is a billion-dollar company. It's almost always on the Forbes top 500 list. It's usually in the top three. Um, but they caught a lot of slack because Walmart had a practice of hiring employees but keeping them under 30 hours where they didn't have to offer them insurance. So if they actually employed them for 30 hours or more, Walmart would have to provide insurance for them. So what Walmart was doing was hiring a lot of people, but keeping them part-time. So they're saving money because if they hire them as part-time, they don't have to offer them insurance. So they caught a lot of slack from doing that. So Affordable Care Insurance Exchanges, again, this goes back to the Affordable Care Act. You can actually just read through these next couple of slides. It's pretty much straightforward. Just tells you the different options of the plan. And again, the reason why we put this on there is because, again, it's actually in the Supreme Court right now. Current administration is trying to wipe out the Affordable Care Act and the pre-existing mandate. So you'll see a lot of it in the news in the next coming weeks, and especially the beginning of next year. This just look over this as FYI. There's just 4 different plans that the Affordable Care Insurance Exchange has: the bronze, silver, gold, and platinum. Platinum obviously would cover the most, but would be the most expensive. And this just gives you an example of each. If somebody was to purchase the Affordable Care Insurance Exchange. So you can just look over those. They just basically just gives you an example of the exchanges. And you can read through this. A lot of this stuff is FYI. Finally, we're going to get to the military health insurance. So the Defense Health Agency, which is known as DHA, they administer what is called TRICARE. And actually, the TRICARE cards look just like this. It looks like a person's personal ID, kind of looks like a military ID, but it has their insurance information. So if somebody is an active member with the military, they will have TRICARE because this is the insurance that the military issues its members. But you're still going to bill it just like you bill any other plan. And basically, this slide just breaks down the information that's on the card. Most of the insurance information, as far as the ID number, is usually on the back of the card if you want to verify the information. Usually there's an 11-digit number that may be used for TRICARE claim submissions. So just basically the take-home message, just know that the military uses a health insurance, and it's basically known as TRICARE. All right, well, that actually wraps up Chapter 8. Again, any questions about any of the information in Part 1 or Part 2, just basically message me, or you can comment. This should be available to you in YouTube within 12 hours or so. I'll load this up on YouTube, but it takes a few hours before they actually post it and you can actually view it. But any other questions, just email me, call me, message me, and I will get back with you if there's anything on this slide that you didn't understand. Thank you.